kind of, what we were trying to test, and then the preliminary research that we used to then help design the campaigns. And then I'll hand over to Amber, who kind of led on that part of the project before then going on to the results later on. So we know that, just to be a bit of context, we know that older people from deprived areas and people from Black communities in the UK are extremely less likely to actually get their routine vaccinations. They're also more likely to be hospitalized if they contract these diseases. So there's clearly a huge issue with inequalities and kind of uptake, and also kind of once they contract these diseases. But there might be a huge opportunity to address this inequality. We know that older people are increasingly using social media, also people from these marginalized groups. So this offers a real opportunity to actually engage these communities with vaccination and hopefully address these inequalities. Next slide, please. Next slide, please. Oh, yeah. But there is a big but. We know that younger people are still more likely to use social media and to engage with its content, so they're far more likely to post. We also know that there's a kind of limited but emerging evidence base that younger people can actually influence the health behavior of their older relatives. So to give you an example, a recent study in China found that grandchildren who stayed with their grandparents over the pandemic actually positively influenced their health behaviors. So, can we build on that? We also know that older people actually tend to use social media mainly to keep up with friends, but in particular family and kind of relatives. So there may be a question here, could younger users be part of the solution to engage their older relatives, both online, but also those who aren't on social media? Next slide, please. So what did we try and test? Well, firstly, we really sought to understand, can social media be used to effectively increase routine vaccination uptake among older people from deprived communities, including those from Black communities? And why is this new? Well, we know that, most social vaccine campaigns actually don't explicitly target marginalized groups, but also the impact is often not measured. So the impact on vaccine uptake is often not known. So that's a bit different. Secondly, we also sought to understand, is it more effective to engage older social media users directly, or is it better to actually use younger users as a conduit to persuade their older relatives to get vaccinated? So that could be via conversation offline or a message online. Now, this hasn't been tested before in social media. There have been some campaigns that have used this offline. So to give an example, in China, some school children were encouraged to kind of speak to their fathers to quit smoking, and that seemed to be very effective, but we don't know if this will work online. And in terms of methods, we did some preliminary research to kind of really understand what engages our target communities, what messages resonate with them, and we use this information to design a number of campaigns and tested their impact. Next slide, please. So just really quickly, kind of in terms of some of the preliminary research findings, a key finding is that our target communities many in our target communities didn't know that they needed the pneumococcal and shingles vaccine. So a lack of awareness is the main reason those communities haven't taken those vaccines. In terms of the flu vaccine, the barriers are a bit more varied. A lot of people know about the flu, so it might be that they don't have time, or they don't think the flu is dangerous, or they didn't want to go to the doctor. So potentially as a result of COVID. But interestingly, in terms of motivators, we know that the key motivators for these communities to actually take these vaccines are to keep safe. So they know that it's dangerous not to take these vaccines, but also to get a reminder or recommendation from their GP or the NHS. So health services play a key role in motivating old adults from deprived areas and people from ethnic minority communities. We also saw that many people from these communities say that younger relatives pass on health messages, particularly those from ethnic minority backgrounds. So, there's a real kind of something we can build upon, potentially, something that's already happening. And these conversations often happen, offline at home, and often actually influence behavior. And we also found that, many people in our target communities use social media, over 80%. And that's, so they're not less likely to use social media than those not in those communities. So there's huge scope to reach people there on social media. But we also found many say they would distrust health information found on social media. So, we need kind of a professional organisation. The NHS is something that would ensure that they could trust a campaign. Next slide, please. So we also tested kind of different messages on our target communities. And we found that those aged 50 to 65 are particularly prone to anti-vax sentiment. They were suspicious of anything that they thought was coercive or manipulative and preferred factual information. This is similarly the case for those aged 65 and over, but they were generally more positive, a little bit less kind of, thinking about messages being coercive for those a little bit younger. And those in the youngest age groups, we saw that they preferred softer language. They didn't want to tell their older relatives what to do. They wanted to have a conversation. They liked warm, emotive messages, but also they needed some factual information to break down communication barriers. So many feared they didn't have the knowledge to have a conversation and would worry about passing on misinformation. So anything that would help that is important. And it's particularly those in their 30s and over that said they might have a conversation. Those in their 20s thought it wasn't their place to kind of do that. So we kind of used this information to create campaigns that were trustworthy, conversational, open, family-oriented, warm, and informative. So kind of using that information to design the campaigns. Next slide, please. And in terms of kind of designing the campaigns, we designed a number of campaigns discussing the flu vaccine and the pneumococcal vaccine. We didn't have kind of within the time frame to also look at the shingles vaccine. And we kind of showed these ads to two clear audience groups on Facebook and Instagram, which were the most popular platforms among our target communities, so older people and younger people respectively. So we had Group A, an older audience group who were eligible for the vaccines, and Group B, a younger audience group who were not, just under the age eligibility for these vaccines. And we kind of, our audience included people in deprived communities across Great Britain, but unfortunately it's difficult to target ethnic minorities on social media or people from Black communities, and there are very good reasons for this, but meant that we couldn't explicitly use that as our kind of audience base. So I'll now pass over to Amber, who will kind of talk a bit more about the designing the campaigns and her kind of thoughts. She led that part of the project.
Thanks, Sophia, and hi, everyone. Yes, I'm Amber. I'm the CEO of Digital Willow. We're the marketing agency that supported and worked with the ILC on bringing to life the creative assets, buying the media on Facebook and Instagram, and also looking at the tracking and analysis from when people first saw the ads right through until the landing page and clicking the book to get your vaccine buttons. So if we just skip through, thank you. This is a really quick snapshot of what the creative assets looked like, just to give you a feel of the campaign. We had three different formats. We had a static image, a single image, we had an animated GIF, and we had a video. I suppose, not surprisingly, the video had the most engagement with the audiences. In fact, it had 75% of the engagements. Interestingly, the animated GIF had by far best reception with the younger audiences. So 97% of the comments on the animated GIF were from the younger audience. We didn't think it would be quite that high. And moving through, thank you. When you've seen the ad on Facebook or Instagram as a user, you then were directed or encouraged to come through to this landing page. This is just an example of one that we put together for the pneumonia or the pneumococcal vaccine. You could start by seeing a video at the beginning and a little bit more information about why you should book the jab, and then a really easy to book button, that orange button that you can see at the top there. Then it was really important that we made it easy for people to share this information with their family, their friends, their relatives. So that's what those buttons were just below. WhatsApp and the Facebook button were by far the most popular sharing buttons. And then if people felt the need or were encouraged to give us a bit more information about their opinions on vaccines, there was a survey and a competition, which is that second orange button you can possibly see on the PowerPoint below. I think finishing off, we just put a bit more information about each of the vaccines so that people that needed a little bit more credibility or a little bit more trust were able to kind of gain some of that information before they acted upon the information we were presenting. So that is the kind of campaign in a really quick nutshell. Before I hand back to Sophia, I just wanted to talk about two things that were really top of mind when I think back on this campaign and working on this project. The first was the tracking and analytics. when you factor in all the clickable elements and the engagements, there was over like 30 metrics that we needed to record. And whilst this might not be the most glamorous part of the campaign to share with everyone, I think it was really important just to point out that that planning up front was absolutely crucial to making sure this campaign ran well. I'm particularly proud of the efforts that we put together as a wider team, figuring out what we needed to track in advance and making sure that every button, every click was coded, because there's no going backwards. Once you start going live with media on Facebook and Instagram, you can't then change your mind and say, I'd like to see the data on these particular elements. You're sort of off and away. And if you're going to do a campaign like this, I would recommend putting that time in for the planning up front, because it's absolutely key in making sure that the results Sophia's going to talk to you about soon were reliable and were robust. And so this campaign, I can assure you, was. I think the rigor behind the data gave us some really interesting insights as well that we can talk about in confidence. Like, for me, I work in social media every day, and I was so surprised how engaged the older citizens of the UK were with the communications. Like, it really blew my mind that they were twice as likely to share the content, whether that's on Facebook, on Instagram, or share from the landing page. Twice as likely is kind of crazy. They were slightly more expensive for us to hit as an audience to pay Facebook for, but we got that back twofold because we got a higher click-through rate from them. And in fact, nearly 74% of the comments came from this older audience. To me, that just said, social media is clearly not for the young, and I needed to remove my own biases on that topic, and have now done so. The second thing that I just wanted to raise, because I think it needs to be mentioned, is obviously there's a lot of fake news on social media at the time, particularly around the COVID jabs, as I'm sure you guys are so aware of. And yeah, look, we were worried that we'd come up against some public backlash on this topic. One of the ways we got around that was by using real people in the ads rather than actors. And it was a conscious decision to make sure that we got people from the target audience into the creative, into the videos, because I think it's much harder to disregard real people if they're telling you their personal opinions on things, rather than a kind of brand or a company coming in and saying something. And OpenAge were amazingly helpful with that. We got to work with them to film a panel of volunteers. So very thankful for that help. Of course, there were still comments and trolls on social media. That's kind of unavoidable. There were people telling us all sorts of funny things about vaccines. I think, ironically, the trolls didn't realize that they were actually helping us. Like, it boosted the Facebook algorithm by commenting so much. The algorithm can't tell the difference between a good and a bad comment, or a bad or a good emoji. So we were getting more, reach and awareness. And what it also did was it got people that perhaps weren't so opinionated about anti-vaxxers to come on there and say, I'm going to give this a positive smile or a thumbs up. In fact, 76% of the people that saw the ad actually reacted or engaged with it, which is kind of mind-blowing, because that's 3/4 of the audience that saw the ad during that 1 month period, liked, commented, shared, or clicked on the campaign. So from my point of view, looking at that compared to other social media campaigns with a cost per engagement of 4p, it was kind of quite mind-blowing. I think Sophia she'll drive home some of the more results about the numbers and so on, about how prevention is better than cure and how social media was able to sort of prove that. Personally, I was blown away by how effective it can be in spite of everything that was going on in the world at the time. And I look forward to seeing more health campaigns presented in this way. Yeah, back to you, Sophia.
Thank you, Amber. That's really helpful. And I think it's especially helpful to hear from a social media expert in the success of the campaign, but also what that means for the future potential of social media for public health campaigns. And we'll get into that in a lot more detail. So now I'm just going to pass over back to Sophia to talk through some of our findings. Thank you.
Thanks, Kate. Thank you. Next slide, please. So yes, really great remarks from Amber on kind of, how, what the engagement was significant essentially. So, what did we find? Well, essentially our campaigns did resonate with people from deprived areas. We know these are really hard to reach offline in terms of engaging with immunisation. So we're really kind of mind blown by the engagement stats. We didn't actually see the same results for people from ethnic minority communities, mainly because we couldn't measure that. But also from our survey, we didn't see that. And I think it's not clear whether they just weren't particularly likely to answer the survey or weren't engaged, but that's an area. But in terms of the key kind of metric, really, did these campaigns increase uptake? And the answer is yes, they did. They did effectively increase uptake. And actually the flu vaccine campaigns targeted older adults likely increased uptake cost effectively. So we found that the kind of cost per quality adjusted life year gained as a result of those flu ads by encouraging people to actually book a vaccine appointment was far lower than the NICE threshold, where if you go above that threshold, it's basically deemed not cost effective to pay for an intervention. And we use very conservative estimates, so we're really quite interested in these findings. Turning to the pneumococcal ads, we weren't able to test for cost effectiveness simply because it's really complicated to do so in the time frame. It would take a number of months to test cost effectiveness. But actually, the booking clicks actually were a far lower cost per click than the flu ads. So they generated the highest impact by far. Why is this? Potentially because we know that uptake is actually lower among deprived populations for the pneumococcal vaccine compared to the flu vaccine, and we know far less people know about that vaccine. So maybe it's kind of a low-hanging fruit element there. There's far more that people could learn. And just kind of putting those findings into context, if we look at the cost per booking click, we see that overall this was about £35.50, but for the pneumococcal ads targeted older adults, this was just £12.50 to get someone to book a vaccine. And to put that in perspective, that's about 136 to 425 times cheaper than in pneumonia-induced hospital costs, so the cost to treat someone with pneumonia in hospital. So, clearly prevention is better than cure. And I think social media clearly needs to play a role in kind of preventative interventions for marginalized groups. Next slide, please. So turning back to the second key question, is it better to target older audiences directly on social media or to kind of engage first with their younger relatives? And what we found in terms of trackable impact, it's far better to engage the former older audiences directly. So we saw that those ads targeted older audiences generated far greater engagement, I think as Amber mentioned, and booking clicks. And interestingly, we're fascinated with the results around shares. The ads targeted younger people, encourage them to share the ads, not those targeted at older audiences. So it's quite fascinating that, we saw that kind of, blew away what we were thinking at the beginning, that they're less likely to post, etc. So clearly, social media works, these campaigns work if directed at older adults. And kind of looking at the booking clicks, our key metric, the cost for a younger audience to click on to generate it. Sorry, the ads targeted at younger audiences generated booking clicks at a cost of about £193 per click. That's about compares to £20.50 for older audience. So clearly is far more impact on that metric. Next slide, please. So there is a little bit of nuance with the findings for younger audiences, because actually they were far more likely to be engaged on one key measure. They're actually more likely than older audiences to actually click on the ads to go through to the landing page. So clearly they were interested, they wanted to learn more. But once they went on the landing page, they actually were less likely to do anything. So they were less likely to share the ads. And then, of course, that, as a consequence, generated fewer booking clicks from their older friends and relatives. So what is going on? Why did they click on the landing page and then essentially do nothing, and not do nothing, but not act as much? Well, what we suspect is that younger adults may have spoken to their relatives offline. So we saw, nearly half of younger landing page survey respondents actually said they plan to share the ads, via conversations or a phone call. So doing so offline, and that would be something we wouldn't be able to track. We also saw that, younger audiences visited the landing pages over 4 times. That was more times than they actually saw the ads on social media. So they were coming back to the landing pages interested to review the information. which also makes us kind of wonder, whether they did do something after seeing the landing page. And finally, I think it's really worth exploring this further. It's actually cheaper to reach younger audiences than social media. So, if we do see that they are more engaged in one key metric here, it really is worth thinking about, did they act? We could essentially find a very cost-effective way and to boost public health if we kind of look into this issue further. Next slide, please. So if we turn now to the landing page survey responses and our comment analysis, some key findings emerged. So firstly, what we saw is that many of the follow-up actions weren't immediate. So we saw that with the younger audiences, many were thinking about sharing, but also older respondents also said, the majority actually said they're planning to or thinking about getting the vaccine and they haven't done so yet and they want more information, maybe to talk to their GP. So that might mean we may be underestimating the impact of these campaigns. Many people, maybe have took some time to kind of think about what to do next. We also saw quite clearly that of those that didn't book a vaccine as a result of our campaigns, mainly didn't because of GP-related barriers to getting vaccinated. So they said they didn't have a recommendation from their GP, so they didn't feel confident to book, or they struggled to book an appointment via their GP. And that's especially the case for the pneumococcal vaccine, which is not offered, the NHS version is not offered in local pharmacies. So that was clear health system related barriers. And I think just kind of following on from what Amber said, we did see generally overwhelmingly positive survey responses. People found the campaign to be informative and positively change their perceptions of these vaccines. We also saw the reactions were positive. Actually, most ad comments were negative. There are a lot of people putting personal comments about their experiences of vaccines on the kind of ads, and also kind of questioning health systems, who's paying for this, etc. So clearly a lot of anti-vax sentiment there, but potentially that anti-vax sentiment could have driven up engagement. We saw many people actually responding with positive responses, so that's something definitely to explore. Next slide, please. So what can we do? What should we do as a result of kind of these findings? Well, we think very clearly that health policymakers should build the evidence base and scale up these findings. Clearly, social campaigns, vaccine campaigns work for marginalised groups, in particular people from deprived areas, and particularly those that discuss kind of less well-known vaccines, the pneumococcal vaccine. I think the shingles vaccine would also be really worth looking into. So I think we're clearly underinvesting in these campaigns as a form of prevention. There's far more we can do. Secondly, we need to measure the impact and cost effectiveness of future social health campaigns. We need to know what works. We found that we were able to kind of benchmark our findings to kind of health kind of industry adverts, but not actually kind of health vaccine campaigns. And that's what we would really like to do, to know what works and how this compares. But we can only do that if the benchmarks are published. We also think it would be really useful for NICE and other key stakeholders to provide guidance to help us judge cost effectiveness, particularly for marginalised groups. We know they're more likely to go to hospital as a result of these vaccine preventable diseases. That means cost effectiveness is likely to differ. And I think it's really important that we understand this. And so we understand, in what ways we're underinvesting or overinvesting. Next slide, please. We also saw that there's, a number of health system related barriers that I think we really need to address. And we can do that by offering the NHS pneumococcal vaccine in community pharmacies. We know people prefer to book their vaccine there. We also need to ensure that all GP practices send reminders and consistently discuss a pneumococcal vaccine. We saw that this was actually inconsistent, and many people, over half of our target communities didn't know that they were eligible for these vaccines. And also make it easier to book these vaccines. Somebody said this site is pointless as you just get bumped to your GP where it's not possible to book an appointment. Can we not make it easier for people to book their vaccines? And we saw that, with the rollout of the COVID vaccine. We know we can do this. Why not do the same for routine vaccines? Next slide, please. And finally, I think there's some kind of recommendations for further exploration. We did see that we weren't able to test the impact of our campaigns on kind of ethnic minorities, people from Black communities, even though we think there's a really important case to do so. I think there's a very good reason why you can't use that data. That can be manipulated and used for very negative purposes, that has done in the past. but we're kind of questioning, are there ways, we can encourage social media owners to share data with government health systems while mitigating against those potential risks, to use that data for public good in certain areas. And finally, we know that there's a number of questions still unexplored. In particular, is it better to engage younger family members, or should we engage them as well as older adults when we want to increase the vaccine uptake of older adults? We definitely see there's a case to explore this further. They're cheaper to reach. They were engaged in some ways. We just couldn't track the follow-up impact. And I think governments would be better placed, government health systems would be best placed to track that, as they would be able to link up to health system data directly. And finally, we talked about that kind of anti-vax comment. Did it drive up engagement? Was it positive or negative for our campaigns? We suspect it might have been, and it might be worth exploring that further. Next slide, please. So just to conclude, as we've said, we've seen social campaigns, are cost effective and an effective way to increase vaccine uptake among deprived adults. So marginalized groups can really benefit from these campaigns, particularly campaigns talking about less well-known vaccines. We're probably underinvesting in these campaigns as a form of prevention. Social campaigns absolutely have their role, but we still need to understand what works for people from ethnic minority backgrounds and people from Black communities where uptake is particularly low, and younger populations. We need to kind of look at that question more. It's definitely worth looking at, engaging younger adults as a conduit. We also saw that our target communities particularly claim to struggle to see the GP or book a vaccine appointment, and we can, overcome that in certain ways. And finally, we looked at what we need to do next, and in particular, increase investment in social vaccine campaigns targeted marginalized groups. And we need to measure the impact. We need to know what works. We need to address those health system related barriers to vaccination, and finally test those unanswered questions and consider whether there is a role to use social media data for public good, for better collaborations between government health systems and social media companies. Thank you. And I'll pass on to Kate, and I look forward to the Q&A.
Thank you, Sophia. That was a fascinating presentation. Thank you so much for that. I now turn to our expert panel of 6 speakers to give their reflections on the findings. This project has been supported by a grant from the Vaccine Confidence Fund with investment from Facebook or Meta and Merck, aimed at boosting vaccination confidence through social media. We are later joined by Michael Thornwell from MSD. But first, I'd like to start with Professor Sir Andrew Pollard, who is the chair of the Joint Committee on Vaccination and Immunisation. Welcome.
Hello, thanks for inviting me to join the panel. I'm speaking in a personal capacity today, not as chair of JCVI. I think it's probably a good place to start is to think about some of the context around this. And I think for all of us, the last 2 years of the pandemic with COVID has shown the remarkable impact of vaccines in populations like ours here in the UK, where the vaccine has been widely used. And I think today we've got this very stark contrast with settings like in Hong Kong, who really, if you were there today, would feel like we were back in March 2020 in an unvaccinated population, largely unvaccinated, where the long period of social distancing and lockdown has meant that essentially it's a naive population that's now meeting Omicron for the first time. And the impact of the pandemic is the same in Hong Kong today in an unvaccinated population as it was 2 years ago for us. And that just is a reminder of how incredibly effective vaccines have been in this pandemic, that today we are having this conversation online, but there is no reason why we shouldn't be in a conference center meeting together because we have a highly immune population now through vaccination. And it's also worth remembering that routine vaccines today, as they have been doing for decades, are silently saving the lives of people from other diseases and children, as well as older adults, as have been particularly studied here. Millions of deaths are averted every year as a result of the vaccine programs. But the converse is also true, that vaccine hesitancy kills. I mean, that's the situation we have today in some parts of the world. And I think it's critical that we understand how better to address the concerns of the public, provide information to improve access. And now I think this work that's been done is very important in trying to start to inform how we might do better in that regard. Vaccines have a major role in improving public health. They also are important in reducing inequalities. Vaccines work just as well, irrespective of race, education, or wealth or deprivation. And so if we can get vaccines to people, that is actually should be a major component of the work that we do around reducing inequalities in our society. I think in the background, there's been a lot of interest in use of social media to provide public health messages. But I think one of the concerns has been that social media does tend to be a bit of an echo chamber where people with similar views post information to each other, enforcing those views. And I think one of the points that to me that comes from this work is the importance of actually engaging with the approach that's needed to target individuals, in particular segments of the population, to ensure that the information does reach those for whom it's important, and perhaps to influence health behaviour. Most work in this area previously, to my mind, has not really addressed the critical question about whether there's impact. That lots of people have been playing with social media to provide information, but whether that does anything to change behaviour. I think that's one of the great strengths of this work, is showing that by targeting particular segments of the population, and that there can be impact. Those click-throughs to appointments are, I think, a fairly unique feature of the work that's been done here from a health perspective. I think also was very striking is that you have to do different things with different segments of the population. Not surprising. It's not only a difference in whether you use Facebook, which means you're older, or Instagram, which means you're younger. And I was disappointed there's no TikTok users here, so you're not going young enough. But I think that really does emphasize the importance of understanding the population. And I think too often when work is being developed around this area, that people do what they are familiar with, not what the target population is familiar with. And this may be one of the reasons why, particularly for the concerns about the ethnic minority groups that were discussed, we need to actually engage with those populations to ask them how best to organize these campaigns. So as I said, I'm particularly pleased to see the use of social media to drive action. And I did mention TikTok on purpose, as well as the younger generations, because if we're really thinking about how do we provide information and influence, it's not just about today, it's about the future of immunization. And the group that perhaps most needs to be influenced are the young, because they are the future users of immunization, both when they become parents, but then later in life with the life course vaccinations that you've been studying here. So in some ways, I would say that those younger groups are perhaps the most important, certainly in the context of immunization in the UK today, where most of the doses of vaccines given are to young children. And it's people before their parents who really need to understand the power of the needle in keeping their children healthy. 100 years ago, the pandemic of influenza occurred at a time where we had very little understanding of these terrible infectious diseases that can strike around the world, either as endemic diseases or in epidemics. And we certainly had no access to prevention for flu at that time. It's also striking to me that there is the coincidence 100 years ago of a war followed by a pandemic. And here we're living through a very dark time in Europe. And those social disruptions that happen as a result of these sorts of crises with population movements of refugees are exactly the circumstances where immunization has to be absolutely at the forefront of the public health response to prevent outbreaks of disease. And one of the reasons I feel particularly concerned from a health perspective about what's going on in Eastern Europe today is vaccine hesitancy. We're dealing with a very vaccine hesitant population in Ukraine and the surrounding countries, and really thinking about how at this moment, lives could be saved from COVID and other diseases and prevention of infectious diseases in children by making sure today we get on and do some work through social media as well as other approaches to enhance understanding of vaccines and to inform. It's really a stark reminder that we need to be better at understanding how to provide information to the public in different settings around the world. I don't think we should underestimate how critical it is to do that. The work of ILC here really, I think, has provided a starting point to give us some insights into how social media might be used in the future to reach and support decision making amongst the public, particularly those who are hesitant, remembering that the vast majority of people who are not vaccinated, it's either because of access to vaccination or it's because of the lack of information that's accessible to them. The group who are absolutely anti-vaccine are a very small proportion with unshakable views. It's that much larger group who could be helped, and indeed their lives might be saved by these sorts of efforts. And I'll stop there.
Thank you very much, Andrew. That's incredibly helpful. And I agree with you. I think social media isn't tested enough. And we need to develop our understanding of how we target and reach diverse communities. But without really understanding how effective various campaigns are, it's quite difficult to sort of develop that. And as you say, the importance of engaging young people, there's huge potential in engaging them on this topic for their futures, but also engaging their older generations. I'm going to pass over now to our second speaker, who is Dr. Catherine Duggan, the CEO of the International Pharmaceutical Federation. Welcome.
Thanks so much for inviting me today, and I'm delighted to be part of this discussion group. As you mentioned, I'm the Chief Executive Officer of FIP, the International Pharmaceutical Federation, and the Federation is a global organisation for pharmacists, pharmaceutical scientists and pharmacy educators. We're made up of around 150 member organisations and 170 academic pharmacy institutions across the 6 regions of WHO. And we represent about 4 million pharmacists, pharmaceutical scientists and educators. We were founded in 12. We are located in the Netherlands, and we've been in formal relations with WHO since 1948. Since 2018, we signed pharmacy up to the Astana Declaration and sought to then overtly demonstrate the impact pharmacy can play in the attainment of universal health coverage through primary healthcare. We identified 3 big areas of work around prevention, safety and NCDs. And prevention is a great big theme under which sits self-care all the way through to vaccination and immunisation. And little did we know, colleagues, that the issues we had seen around vaccinations would become so acute and relevant for global public health as it has done in the past 2 years. And exactly as Andrew mentioned just before, this is not going to go away overnight. We've got to prepare ourselves for the next pandemic, even though that is feels very gloomy at this point when we're not through COVID-19 just yet. We have set out 21 development goals, which include within that portfolio issues pertaining to pharmacy, but also issues pertaining much more widely, including equity, access and sustainability. And within equity, we grew that goal, if you like, from focusing on gender equity and diversity with the workforce focus, being a profession that is predominantly made up of women in all countries. Around 70% of pharmacists are women. And we also saw that inequity was a really big issue during COVID, not just for vaccination access, but also looking at the way in which the virus impacted different age groups differently. And of course, when we did the solidarity movements of lockdowns, then those that were least at risk were also bearing different burdens of equity as well. So children who were living at home with no access to resources from schools suffered levels of inequity. We also saw inequity due to socioeconomic status, health literacy, workplace stresses. So equity became a massive issue for FIP. And vaccine hesitancy sits within that. If you don't have access to the right information tailored to your needs in your communities for your background, then it may jar, and it may just serve to, I suppose, increase the hesitancy you may have in believing the place of medicines in society, and then for your family and your personal use. Over the past decade, we've been developing resources, toolkits and guidance for vaccinations through pharmacists and pharmacies. And we conducted several surveys over that time, watching as countries and health ministries supported pharmacists' role actively in administration of vaccines, perhaps focusing on flu at the very beginning, all the way through to watching countries literally pivot during the pandemic into enabling and supporting pharmacists to be able to do that for COVID. And we now see pharmacists in many countries having the opportunity to be part of the life course immunisation piece. And I think the more we as a profession can open the door up to working within communities, for communities and with communities, as the community saw during COVID, and pharmacies remained open and accessible at whatever point of care was needed, I think we stand a greater chance of addressing the issues of vaccine hesitancy. Let's not forget that the staff who work in pharmacies that are based in a community very often come from that community themselves and can really explain and debate and inform. That's really important to know how the past decade has changed things. And what we have seen is polarisation around views, and then polarisation around decision-making. We see this very much. I don't know if it's of interest to any of you, but Professor Pollard mentioned about the dark times we find ourselves in Europe, coming out of a pandemic and perhaps into a war, definitely into a war, but how far that war will reach is still an issue of great and grave concern. But those who were part of the denial of the place of vaccines in the solution for COVID seem to also be in denial about an awful lot of other things as well. So really, it's the people in the middle that we need to affect and support. And expanding vaccination coverage while ensuring equitable and sustainable access to all is critical. In FIP's views, I don't think it's a view that is too contentious for us to achieve universal health coverage. Identifying enablers and barriers to widened access, especially with regards to literacy, convenience of access, vaccine confidence, good communication, tailoring of messages, and really working out why someone is hesitant as they stand in front of you without just giving them a fact sheet that may seem to not address their own particular concerns. All of these play their part in accelerating progress towards vaccine uptake. And FIP recognises the bespoke approach needed to widen vaccine access to older adults. We therefore commend and applaud the International Longevity Centre UK on their newest report. We are so super excited to be able to learn from this from our profession. We'd love to be able to produce some corresponding guidance for pharmacy in all our different countries, in all our different regions. This new report, Generation Vax, leveraging intergenerational relations to increase routine vaccine uptakes, I think not only addresses the issues that may affect our ageing populations, but what you've done super smartly, I would say, is to work out a way that we can get our younger people involved in the advocacy role. And maybe where they may have issues around hesitancy, their fears may be allayed as well. But I've seen it in my own family. I've seen it in different families that I've been honoured to be with during the pandemic at different points, where the youngsters can really support the elders in that family environment. And I think that's a way of getting the community to feel more in touch with each other. This innovative approach not only contributes to the improved vaccination coverage we all seek, but again, as I'm just mentioning, to social cohesion across the age groups. And that's got to be a good thing. We believe that the findings will have a positive impact on how social media can be effectively used to reach the older populations. I happen to know that my parents, not that elderly, do not engage with social media. So I know that if we could get the younger members of the family to advocate, I think my parents are pretty much, they've got them at hello. They're so enamoured by their grandchildren that if the grandchildren can access this for them, then it becomes a really, really easy way to engage and support. And coupled with access to healthcare professionals and vaccine services, including, may I say, through pharmacies, will bring us all a step closer to vaccine equity. And I'll leave it there for now. Thank you so much.
Thank you, Catherine. That's hugely helpful. And I think very interesting to hear about the relationship that you've seen between vaccine hesitancy and access to health services. Then the importance of working with communities, which I think in terms of what happens next with this research is absolutely one of the things that we call for. And the role of young people in that advocacy role. There's so much more that we could do. And whilst the research doesn't necessarily show that action, we know that there is potential there. That is what the research is telling us. Wonderful. I'm going to pass over now to Michael Thornwell, who is the Associate Vice President for the Global Vaccines Confidence from MSD. Hello and welcome.
Thank you, Kate. Thank you, Sophia. And thank you to all of the ILC for inviting us to participate today. It's a very proud day. And I stand here sort of smiling because when Merck, among many other partners who are part of this panel today and part of this webinar today, founded the Alliance for Advancing Health Online, it was in hopes, engender this type of research. It was in hopes to accelerate this gap that we saw around how do you utilize social media for good and what are some of those best practices we can begin to share globally. And I applaud this research. I think this is outstanding. And I just want to echo 2 points from the very beginning that was presented this morning. One around Dr. Andrew Pollard, who mentioned how unique it is that this research is beginning to show that there is actually an impact. It's one of the hardest things to do is to measure whether or not you're actually engaging people online and actually driving positive health behavioral change. And I'm so encouraged by the fact that we saw not only older individuals who I have to personally wrestle with the fact that I'm now in your cohort of older. So I'm personally wrestling with that myself today, but I accept that. And I will say how they want to share 2 times more, right? And that is really, truly, you share things that you're not only interested in, but you find valuable. And I really think that is really an interesting finding. And the other thing I want to highlight is that you saw, I think it was greater than 800 potential bookings of people that are going to go intend to be accessing the jab. And I think that's just truly remarkable that we've not only engaged the right populations with meaningful content in a meaningful way, but you've actually then driven them to behavioral change. So I applaud that work. Many of you probably understand MSD as a global leader in vaccines manufacturing, and that's certainly true. But we also have a significant imperative around helping global hesitancy, and we see the effects of global hesitancy. And we know, many of us know, that hesitancy can largely, maybe bluntly, but largely be attributed to 3 main things, right? It's lack of confidence. It's certainly a lack of complacency, or maybe too much complacency in the disease, and certainly lack of convenience. And so what was intriguing to me as I read through the findings is that this study, this research, highlighted, I think, 2 of those 3 in particular. Certainly when it comes to a lack of confidence, you really demonstrated the awareness gap that we have with many populations, especially underserved populations, with respect to understanding that they were even eligible, or that they should be, or that they're recommended to be for a particular vaccine, like potentially pneumococcal or others, or the flu. That's a truly important finding, I think, and it shows we still have much work to do. But the other thing I think is that awareness then leads to knowledge seeking. And it's important for us to have the right knowledge in the right channels and to leverage social media to make sure that they are seeing trusted scientific-based information. And that's a challenge for us, but certainly one that we can meet and I think do better at. And I think this research highlights that. So that awareness leads to knowledge, which we know builds trust. And we know that ultimately that's what helps populations become more confident. When they see the data, the science that's been studied, and they see health administrators following the protocols and the design of those studies when they administer the vaccines, I think that helps to build population trust and ultimately confidence. And then finally, the other one that was truly highlighted here was the fact that convenience is still an issue for many parts of populations around the world, and anything we can do to improve access, or anything that we can do to improve ease of scheduling, I think is going to be a welcomed addition. And we've seen in many countries where pharmacists are an active contributor in vaccinations or over the life course, then I think that we've certainly seen how that is beneficial. And I certainly applaud the recommendations the ILC is landing on here, and certainly have seen in other countries, in particular the US, where that has been a significant contributor, enabler to vaccine coverage rates. The final thing I'll mention is I was also really encouraged to see the fact that we were able to reach underserved populations and really begin to close that gap. Equity is something that all of us own, and something that all of us need to take an active sort of contributing role to solve. And this is something that I know within the walls of MSD is a huge imperative for us, not only amongst our own employees and workforce, but certainly how we administer and certainly have access to the vaccines that we produce and sell globally. So this was an encouraging finding. And I also think it's truly encouraging to see the fact that there is a familial trend, right? There is the younger interest that was seen, whether we probably have to engage them differently, and maybe the call to action for them is different, right? And maybe it's tailored, but the younger interest is there. They are seeking information that is science, truthful, and proven. And they are certainly, now that we know we can engage older and underprivileged populations, this should be a launching point, in my estimation, for additional research, additional sort of findings, and I think good best practice sharing for others who are seeking to build confidence, build convenience in populations that they're serving around the globe. So, from an MSD perspective, this makes us very proud to see that the research here has sort of not only taken the spirit with which we intended it, but certainly the speed with which we intended the rapid dissemination. I applaud the team for getting out in front of this and doing this research. And I certainly think this will be certainly the tip of the iceberg as it comes to additional research and how to leverage social media for good. So I'll stop there. Thank you so much for having me.
Thank you so much, Michael, for those insights, and thank you for your kind words to the team. I think this is especially important for thinking about how we take the research forward and next steps, and not just for ILC, but wider. And I think there is important global relevance here. Particularly you highlight access and awareness, and like you say, just having a better understanding should hopefully lead to more knowledge seeking. And then, how do we work out what those next steps are? What should we be calling for? And hopefully we'll come on to that in the next part of this discussion. Great. I'm going to move on now to Daphne Holt, who is the chair of the Coalition for Life Course Immunisation. Hello and welcome, Daphne.
Hello, Kate, and everyone, and thank you for inviting me to speak here. Everything I was going to say has already been said by the other speakers, essentially. So I will just pick up on one or two things. First, to say that the Coalition is a broad group of clinicians and academics and advocates for vaccines, both individuals and organisations. And our goal is to increase the uptake of vaccinations at all ages and stages of life. We do exactly as the title says. And we've got members in 12 European countries, including Ukraine. Now, I've been in contact with our Ukrainian member, and the last thing on their mind at the moment, of course, is vaccination, but they do like to know that we stand in solidarity with them. To go to the report, it's really interesting and informative, and there's an awful lot to digest in this. Just picking up on that, on the last point, the barriers to access, if I can put that in the COVID context, in the context in which I live here in rural northwest France. In the oldest group, and I'm referring to 70 to 90-year-olds here, physical accessibility of vaccine facilities was a particular problem. But access became much better, of course, when the pharmacies began to offer vaccination. So echoing what's already been said, pharmacists are an integral part of this. And in other circumstances, of course, the community nurses are able to administer vaccines, particularly against the flu. So another important detail about accessibility. Digital access, on the other hand, is most definitely a barrier in our rural areas. Lack of access to high-speed internet connections, weak mobile phone signals, they affect all ages, of course, not just the elderly. But here in my community, there are at least 2 households who have no computer. and more households who have no mobile phones. So never mind smartphones, they don't have a mobile phone at all. And I wouldn't say these households are deprived as such. They're not deprived. They're just old, if you'll forgive me for using that expression. So in their 80s and 90s. So there's little chance of transmitting any kind of messages to them, good or bad, via social media. So the report's already referred to the fact that older people, and I'm referring here to the group that's defined in the report, they're using social media more and more. And it's a little bit sad to see that 50 to 64-year-old, 50 to 64-year-old age group are engaging more with social media, but they also appear to be more likely to believe the misinformation that they find there. And I kind of wonder if this is to do with a great deal of conspiracy content, in inverted commas, so to say, is in the English language. So if you'll bear with me while I return to my lived experience, as it were, in my community, which admittedly is small, so I don't say that this is universal. We have English-speaking residents that speak no French, as well as native French inhabitants that speak no English, and a smaller proportion of us that speak both languages, okay? And it's notable that the English residents who are receiving their information from UK television and the wider English community here and in the UK, they seem to be more likely to believe the easily transmittable falsehoods than the French community who receive their information from French television and by word of mouth. By word of mouth, as I said, the internet access in my community, this is weak to say the least. They're receiving their information by word of mouth from their younger family members and from their healthcare professionals. So I wonder what the methodology used for this research, which was great, would reveal if conducted in non-English speaking countries. I think that would be really interesting. Now, I've got no illusion about this because other countries, Romania, for example, have their own problems with deprivation, access, vaccine hesitancy, and anti-vaccine sentiment. We know that. So with regard to the recommendations, now I've not lived in the UK for over 20 years, so I couldn't presume to give advice on this to the UK government or to the NHS. However, given that a general barrier across all age groups appear to be this lack of knowledge and the worry about transmitting misinformation, which I think Sophia said in the first instance, it would definitely be advisable for governments in general to explore all possible platforms for informing and transmitting messages and all possible messengers. So healthcare professionals, pharmacists, charities, community leaders, faith leaders, the workplace, etc. So everybody transmits consistent messages. That consistency of messaging is important. And for all the reasons I've just given about digital access, not to rely on one particular platform. I think that's really important to look across the board. The point on the impact and the cost effectiveness of social media campaigns, that was well made. And that certainly needs to be explored further because there is, as I believe Sophia said, lots of potential there. And many countries do have online hubs for booking all sorts of consultations with medical professionals, vaccinations, etc. And certainly those here in France have been very effective, and they have been expanded, influenced by the effects of COVID. My real takeaway point from this report, and again, this has already been said, is that the authors have tried to measure the impact of their campaign messages and their means of delivery. And it's really, really difficult to do this, as has already been pointed out. And it's so often overlooked. And I'm so pleased that they've had at least some success here, because that is a really, really, truly important thing to do. So thank you.
Thank you, Daphne. You know, some really interesting themes emerging here, and I think you've really highlighted the importance of addressing mistrust and the importance of young people as an advocate in that is really important, and potential relevance beyond the UK, again, something that could be explored. And you're right, you know, the importance of measuring impact as much as possible, which isn't really done, and is very difficult. But the importance of, you know, being consistent about how we measure and what metrics we use is really important. So thank you for your insights there. Very much appreciated. We move on now to Stacey Nobler, who is the Vice President for Vaccine Innovation and Global Immunisation at Sabine Vaccine Institute. Hello and welcome.
Hello, thank you, Kate. I'll first just introduce myself, and then I hope be able to bring a little bit of context from the space that Sabin works in largely. I have been introduced in terms of my position. One of the key programs that I lead along with a fabulous team at Sabin is our Vaccine Acceptance and Demand Initiative. And within this work, we have a portfolio that looks at vaccination. We have a vaccination acceptance research network, and we look particularly at social and behavioral research that's influencing opportunities for increasing equitable access, uptake, and promoting health, with a particular focus on populations in low and middle income countries. And I read with great interest the ILC report because of so much of the work that we've been supporting in similar spaces to really look at the powerful role that social media can play, particularly as we think about how do we use social media to access what have traditionally been marginalized and hard to reach populations, where we know that it's difficult to get to them physically. And is there this opportunity now through what technology provides us to be able to reach them in more powerful ways? Also exciting to see the work of the Alliance for Advancing Health Online and their work coming to fruition through the Boost community within Sabin, that is a network and a community of practice of over 2,000 immunization professionals around the world. We've had the opportunity to partner with AAHO and other partners within that network. So again, just fabulous to see this work advancing, because I think this is just the beginning of what we will continue to understand about the role that social media can play. And I think just sort of in that context, and in the context of thinking about this as an opportunity to initiate some of that broader global learning, and the way that this report and its findings can continue to sort of inform efforts, not just within the UK, but around the globe. And how do we take this to scale? It's an issue, obviously, for how you take it to scale in the UK, but how can this really inform much effort around the globe? And I think just maybe then to highlight some of the key findings from the report, and then how that relates to these new opportunities to pursue. One that I think has been emphasized quite a lot, but I think is really, really impactful, is what we saw in terms of the use of social media, the messaging of online engagement that allows this opportunity to connect information to action. To take messages about specific immunization opportunities, here specifically around influenza and pneumococcal, and move that into action. Booking that appointment, getting people to take that step that is required to actually get shots in arms. And I think that here is that opportunity to provide that information, even if perhaps you're not looking at a system where you might be able to book an appointment. Perhaps you have a more informal health system where that might not be possible. There's still that opportunity to provide the roadmap to how you get what is needed. And I think that's a key opportunity that really is provided through these new online opportunities. The other thing that I was struck by in particular was sort of the knock-on effect of creating a kind of cascading advocacy through the sharing of messages. There was an emphasis on how much sharing happened, and really being able to build in that opportunity to share, to take a message. If you're moved by this message, if this is something that you think is important for your family, family, for your friends, for your network, to be able to share that information using people who believe in the power of immunization and have been convinced by it, to really share it within their networks. And I think we need to think about that more and more. As Dr. Pollard mentioned, that there's this opportunity to really move younger populations to become the future advocates for immunization. I think it also emphasized something that we have found very much in the work that we've been doing in this space as well, which is the power of storytelling and that opportunity to really promote healthy behaviors through that power of storytelling, being able to recognize who those key storytellers are. And as we think about the use of social media, I think this work really highlights the power of potentially storytelling from younger generations to be able to become those storytellers and those advocates within older generations, but older generations also to be storytellers within their own network. I think some of what was identified in talking about either the absence of or the importance of health providers. Really, again, being those storytellers, making sure that they are recommending vaccination and becoming part of moving that agenda forward. Also, then, I think that again, going back to this notion of, as we think about the role that online platforms can play in reaching the traditionally hard to reach, wherever they may be in the world, there are a variety of things that I think that we need to remember, sort of continue to be attendant to. I think this is balancing and having a better understanding of the extent to which these campaigns are, where they bait and sort of amplify the anti-vax community, but where we sort of turn that on its head and use this same community to really engage in positive messaging. I think we also need to be particularly sensitive to an issue that Daphne raised around the issue of technological access. And as we think about how we use online platforms, always being cognizant of where there may still be limitations in that access to technology, and making sure that we have sort of a nuanced understanding of what are the different platforms that are being used in different populations. I think we saw this in the work that ILC demonstrated in terms of what generation was using different platforms. Was it Facebook? Was it Twitter? We talked about TikTok. We know how powerful that is in the sort of youngest of generations. Other sorts of WhatsApp and a variety of other text-based messaging platforms. Really making sure that as we think about how to design these programs, we're sensitive to that and we're understanding that ahead of time. And going back to some of what was mentioned about the design of this study, making sure that planning and that understanding of the community is done in advance. And perhaps also thinking about how you really need to be co-creating with the community itself in order to understand how are they operating in this online space. And then, of course, I think just to close with the importance is, again, as we think about how do we take this learning and think about scaling it both within the UK and then in other parts of the world, really understanding that cultural context as we think about some of the other things that have been mentioned. How do we make sure that there is a recognition that it is perhaps not a one-size-fits-all approach, but that need to understand that cultural context as we use online platforms in a powerful way to positively promote health and in particular immunization. And with that, I'll turn it back to you, Kate.
Thank you, Stacey. Yeah, you've really highlighted some crucial questions, I think, to take forward into the future and potential new areas to explore in terms of further research. I really liked your term cascading advocacy. I don't think I've heard that before, but it's absolutely right. And it makes it even more challenging to measure, but absolutely fascinating to explore further. and how, as you say, we could capture the potential of young people in particular to become storytellers, which I think we're seeing more and more in issues like climate change, and I think the potential of that, if it could be sort of captured in some way, it is really, really exciting. So finally, we have one further speaker. I'd like to welcome Dr. Ed Pertwee, Research Fellow in Media Monitoring and Analysis for the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine. Hello and welcome.
Thank you very much, Kate, and thanks to ILC for this opportunity to come and discuss this extremely interesting and timely report. I'm a research fellow at the Vaccine Confidence Project at the London School of Hygiene and Tropical Medicine, where I co-lead the digital analytics team. Vaccine Confidence Project, for those of you that don't know, is a multidisciplinary research group that was set up just over 10 years ago, basically to monitor public confidence in immunisation programmes around the world. One of our key initiatives is something called the Vaccine Confidence Index, which is basically a standardised survey instrument for mapping vaccine confidence globally. More recently, we've been building up our digital analytics capability, and we now have a whole set of projects mapping social media signals of vaccine sentiment around the world. During the COVID-19 pandemic, we've been working closely with a number of public health stakeholders, including the World Health Organization, UNICEF, Public Health England and others, to monitor and analyse what's happening within the social media space. Like ILC, we're also the recipient of a grant from the Vaccine Confidence Fund for a project which is exploring the scope to use online chatbots to address common rumours and concerns around COVID-19 vaccines, and that's currently running in Hong Kong, Singapore and Thailand. So that's basically the angle that I'll be coming at this from as a social scientist who's interested in the effect of social media on vaccine attitudes and behaviours, and in how these communications technologies can be leveraged to boost vaccine confidence. And from that perspective, this is a really welcome and timely report, and one that does seem to challenge some of the received wisdom in this area. As was mentioned in the opening presentation by Sophia, and as a number of the other panelists have already picked up on, previous research does tend to suggest that older people use social media less than younger people. And socioeconomic disadvantage can also impact on social media access. So it may seem particularly surprising that this could be a cost-effective way to engage older people in deprived communities specifically. One reason that strikes me as to why it might have been so effective is that the team, and they're to be commended on this, really took the time to pre-consult through surveys and focus groups to understand the best ways to engage people in this particular target group. That sounds like a really obvious thing to do, but I know from experience that it's something that's not always done when designing social media interventions, and at least not done as often or as consistently as it should be. But it's really important because we know from existing literature and existing studies in this area that social media interventions are much more effective when they're tailored to specific target audiences, and that top-down, one-size-fits-all messaging doesn't really work. It's also great that we know, in fact, and can measure that it worked because they built in a monitoring and evaluation process into the study. Again, it sounds like something that's really obvious and that people should be doing all the time, but it really isn't. We did a systematic review of literature in this area last year, and we found only 11 studies that even attempted to quantify the impact of the social media intervention that they were documenting. So this report really does showcase the potential for social media interventions done well to build vaccine confidence and promote uptake when those interventions are well designed. The report then goes on to recommend that the government and NHS invest more in targeted social media campaigns focusing on those who are least likely to get vaccinated. Here, I think it's worth pausing and thinking about whether the government and the health services are always the right vehicle to be doing that. One thing that we know from existing research is that in addition to the framing of the message and the medium, so whether it's text, image, video, a clickable link or something else, what's also crucially important is the messenger. And for some hard to reach groups, so for example, particular ethnic minority groups, government or health services may not necessarily be the most trusted messengers. Finally, as Sophia noted in her introduction, one kind of interesting question left unanswered is whether approaching younger audiences on social media to then engage older relatives through offline channels could be effective, and that's something that's much harder to track. I think this really does point to the need for further research, bringing together different data sources and different methodologies. So social media data, digital big data, surveys, interviews, focus groups, and so on, to better understand how the online and offline means of communicating vaccine attitudes and sentiments really work together and interact with one another. The days when people would kind of log on to a desktop computer for an hour in the evening to surf the internet before logging off and having dinner with their friends and family, those days are long gone. Instead, now people have one of these by their side at all times. They're looking at their smartphones while they're with their friends and family. They're talking to their friends and family about what they're seeing on social media, and they're posting on social media about what they're doing with their friends and family. These processes and interactions are still quite poorly understood, but I think this report really highlights that we're going to need to understand them much better if we're going to leverage social media most effectively in this kind of cascading advocacy model that has just been talked about. So I'll leave it there, but to sum up, I think this is a really fantastic and really interesting and timely piece of work with some very clear recommendations, but also lots of food for thought and some very interesting pointers as to directions for future research. So I will leave it there. Thank you very much.
Thank you very much, Ed. Really helpful to hear about the work you're doing. And yeah, you're right. You ask some really important questions. I think, you know, the limited role of health organisations, you know, are they always the right messenger? But also the need to better understand interactions like you know, online interactions, because the measuring the impact of that is extremely complicated, but we need to understand it better. We need to find ways to measure that. So really, really helpful, insightful questions. Thank you, everyone. That's all our speakers on the panel today. So I'm now going to open up the floor for questions. So if you have any further questions, please do use the question and answer function. I see that a lot of you have already, so I will go through those questions now, and I'll open it up to the group to answer. Some really interesting ones. I'd like to start with two people asked this question actually. So what is the potential for older people as advocates for vaccination uptake for their peers, but also potentially for younger generations? So flipping it on its head a little bit. So if anyone has any particular thoughts on that, I'll let you just jump in.
I can start if you'd like on that top. Yeah, no, I think that's a really interesting question, and that's just something we've talked about actually. You know, we were really focused on that kind of younger generations being the messenger, but I think some of the results definitely indicated that old adults are really keen to be a kind of messenger. And kind of reinforced some of our preliminary research findings that old adults really cared about, you know, the health of their friends and relatives. It was something that was kind of coming through in kind of conversations and the qual research, and so it's quite interesting to see. You know, that even when we weren't kind of explicitly saying on the ads, by offering that option on the landing page, you know, many were taking it. And I think many more are actually thinking about doing it offline, like the younger generations had mentioned. So I definitely think there's huge scope there. You know, that definitely turned on our head our idea that, you know, they're not kind of posting or engaging. And, you know, I think we do know kind of on average that people become more altruistic in later life. I don't know if that's okay to say, that's kind of the evidence says that. So, you know, maybe, you know, there is real scope to potentially encourage people to kind of tell their friends and people of the same age, but also younger people. We know that, you know, for instance, with the COVID vaccine, we know uptake is lower among younger populations, so there may be scope there. I think there definitely can be a role to explore this further. And I think as somebody mentioned, a point that actually having that option on the landing page. I don't think we always have that every time we see a campaign on social media, and clearly this population want to use that. So I think, having that opportunity and tracking it, I think, in many different groups and, the loved ones of older adults, I think we could really use that further.
Thank you, Sophia. Any further reflections on that question? Great. I'm going to move on to the next question, which is, this might be for Ed and Michael in particular, but could be anybody really. How do we measure vaccination confidence? Is there a consistent way internationally for measuring it? And what do you think are the most effective ways of increasing it? So anyone who wants to come in on that, jump in.
I can come in. Was the question is about effective measures of vaccine confidence?
Yes, and is there a internationally recognised way of measuring vaccine confidence?
Well, I'm going to plug our own vaccine confidence index, which aspires to be the standardised way of measuring it. That is based on a standardized set of survey questions which ask about perceived importance, safety and efficacy of vaccines, and also around compatibility with cultural and religious values. And we run that routinely in a number of countries over a period of time, so that we have a consistent kind of longitudinal data set on that. There are other metrics and measures out there as well, but that some kind of standardized basket of questions like that is the best kind of way of getting consistent data across different countries over a period of time. In terms of how to improve it, the key thing really is around building trust. And that means understanding the reasons for hesitancy, not just globally, but in particular communities, as we've been talking about, and really approaching people with empathy and trying to understand where they're coming from, what the particular barriers or concerns are. What it's not about is kind of beating people over the head with a "you must get vaccinated" message, or these kind of other top-down one-size-fits-all messages, as I've been talking about. So I think this particular project is a case study in how to do that, really, because it started from a position of trying to understand the particular issues and concerns within particular target populations, and then design an intervention that addresses those. So I think that's kind of a model for how we can think about approaches to build confidence.
Thanks, Ed. Michael?
I'll just add on briefly, Kate. I think Ed's answer was very comprehensive and accurate, and I don't think there is a great standardized way of doing it yet, and I applaud the efforts that Ed's leading to try to get us to a place where that would be. I'll just make a couple of comments that I think were echoed throughout pieces of the panelists' responses, which is, when it comes to addressing hesitancy, it has to be addressed locally. And I think Ed mentioned this as well. This is not something that you can say, even though I attempted in my comments earlier to say there's three main reasons, but there is, but you have to understand locally how that manifests itself in that population. The messenger matters. The messenger of the content matters. And I think a lot of times we tend to be sort of speaking down to people, or thou shalt, you should be doing this. And I don't know that that builds trust. I don't know that it builds confidence. I think it tells them what your position is, right? And I think it tells them which side of the aisle you're standing on. And I don't think it builds trust. So I think we really need to put more of our efforts into the empathy, into the approach locally, and to have people and creative and images and messages that are coming from people who they consider like them. And we have to put a lot of effort. It's hard to do. It seems easy, but it's not easy. It's hard to do. But the return on that investment is immeasurable.
Thank you, Michael. It leads me on to a related question, actually, which is perhaps for Sophia, which was in your research, how did you sort of navigate those ethical issues? How did you design the campaign to be informative rather than enforcing?
Yeah, no, that's a really good point. And it's definitely something that was coming up from our preliminary research findings. Do not kind of make these coercive, rather than it's kind of more like have a conversation. You can get your jab here. Did you know it's free? It's conversational rather than kind of, and that definitely works better. I think it was a good point about the kind of ethical, you don't want to kind of manipulate people, but we know that this saves lives. And a lot of people aren't informed about these vaccines. So, in terms of our survey responses, so many people were saying, I didn't know I was eligible for the pneumococcal vaccine. So I think you see it in that way. Many people don't have the information to actually make a decision, to make that decision. So, and I think, younger people were saying they want to, inform people. They don't want to tell them what to do. So it's really about having, giving people the information so they can decide. So I think you see it like that. But then again, I would kind of caveat that, even though people were telling us they wanted kind of just factual information, and I think Amber's team were great in, pointing out a bit of emotion does work. We found for our target communities, actually it was kind of warm, positive emotions. They didn't want anything negative. They'd been fed up of all the kind of negative emotions since COVID. But I think a little bit of that does work. And what actually I hadn't had time to mention is that actually personal stories, I think building up on from Michael, what you were saying, we think the videos might be really effective, partly because had people like themselves talking about, I got the vaccine, it's not difficult. I was a bit worried about this, but actually it was okay. And that kind of personal element maybe was better than only having, we also had a health professional, but I think having both actually maybe resonated quite well, the younger and older populations. And that actually builds on from previous research findings that actually say that find that people in kind of deprived areas, if you want to influence their health behaviors, this is other health behaviors, not vaccines, but personal anecdotes really work. So, and I saw that as well in the comments, lots and lots of personal anecdotes. So that's something to bear in mind. If you're creating a video, if you can get a personal story that someone speaks to that person, it seems to be quite effective.
Thank you, Sophia. My next question, I think, is for everybody. So, we could just go around and just very quickly, give the top of your head answer. But if there were to be further research on this topic, what would you be most keen on further understanding? And again, just jump in if there's anything in particular you want to highlight.
Can I have first go on this then, Kate?
Absolutely.
I think I've also already said this, and I think Patrick has also posted a question along these lines about how we can expand this research into European countries, into other languages. I would certainly be interested to see how that would work, and indeed how we could do it. I mean, certainly posting questions in other languages, but also advertising it in other countries, doing your focus groups in other countries with other messages and messengers, because we've already mentioned faith groups would be important, community leaders would be important, and also this idea of advocacy being a two-way conversation. So there are going to be some groups, I think, where it would be the older end of the population who would be passing messages to the younger end. So, and I think in European countries, I think you might find that there would be quite a bit of that. So I think from my point of view, I would really like to see this research, how we could move it into other languages in other cultures.
Lovely. And anyone else want to jump in?
Just perhaps, if I may, to say that the point was made earlier about how important the person sending the message is. And there's long-standing research in the UK showing that the primary care physician is the most trusted person with vaccine information, and that's echoed in other countries too. And I wonder whether there's an issue here of trying to make sure that the right owner of the message is used, to see if that affects the impact. I think the second bit is also that social media shouldn't be seen as an isolated tool. It should be part of the public health program. And one of the questions which we need, frankly, to ask is, how important is this in comparison with the other bits? If you're going to make an investment, where do you make it? And I know that there's been some attempt to do that through the cost effectiveness analysis that you've done. But it does seem critical to me to work out what the package should look like, and to what extent the emphasis is on social media. It may be that we need all of the different approaches, but to really understand how important it is, it needs to be embedded in the wider system.
And maybe to pick up on that, I think it then also, we need to look at this idea, if it is to be integrated, how do we think about this kind of work being carried out, not just by the ILC and their ability to sort of commission individuals that are well positioned to take rather intensive work on, but how can some of this initial work be used to really frame opportunities for within an integrated approach of people that are working within the delivery of services to be able to design efforts that can advance this kind of messaging, to be able to leverage this as a tool within, as has been referenced, sort of their full toolkit of how they're reaching populations and how they're advancing immunization. And so that I think would be a great follow-on piece to say, how do you take the initial research and then think about how do you make this, how do you translate it so that it can be implemented easily by the wide number of people responsible for immunization in different populations.
So to add to the previous two contributions and build on what Stacey's just said, thinking about what constituencies or what jurisdictions we all have, I think it would be really useful to think about the role of the healthcare professional in this. So from a pharmacist perspective, remembering what I was saying about being in the community, and yet social media allows you to maybe access more widely. There are different age groups within professions. Perhaps they could help support this messaging, and in fact, indeed, even their own families and their own support networks as well. And that I think sometimes when initiatives are developed, there could be a risk of not engaging the profession so they can run with it as well. So I'd happily put my hand up and say that pharmacy would very much like to be part of how we would do that through our constituencies. And I think this follows very neatly on from Daphne's point about translating for different patient groups in different countries, then thinking about how we embed this and roll it out based on Andrew and Stacey's comments. So it's a build, if you like.
And if I could just jump in, continuing on a very similar theme, I certainly think it would be worth repeating the same or similar study in other countries, because there are a number of factors specific to the UK which will have driven part of the results. For example, we have relatively high levels of internet penetration, relatively high levels of social media usage. What would this look like in a country where that wasn't the case? And in particular, the cost-benefit analysis, at what point would this cease to be cost beneficial? Because if you're going to develop a toolkit and start recommending, here's a particular way of doing this, it will be also important for people to be able to relate that to their particular context and say, is this the right tool or approach for me in my particular context? Because it may be that in some countries, the cost benefit analysis for this would look relatively worse, and you might want to think about a different intervention instead. So it'd be really interesting to do some comparative work to kind of understand that a bit more, and different factors that feed into the cost benefit analysis.
That's really helpful. Sophia, did you have any reflections on that question?
I mean, I kind of agree with a lot of the points actually mentioned, but I think I hadn't touched upon as much the global angle, and I think that's coming through. And I really agree that, social, that's kind of incredible that we do have the opportunity to scale this up globally. But like, as was mentioned, there are different barriers in different countries. If we was just take the prior populations, that might be slightly different. And of course, the health system differences make it, there'd have to be kind of relevant to that particular country. But at the same time, it was quite interesting when we were doing the research that we found very similar barriers to the pneumococcal and shingles vaccines. Looking at a lot of the previous literature, I think, and the flu vaccines doesn't differ that much in different countries. So that already you've got kind of similar messaging. I mean, particularly for, as I said, pneumococcal and shingles, it's their lack of awareness is the main barrier. And I think that's the case elsewhere. and also uptake. You've got those similar patterns in most countries as well. And you do have countries with similar health systems to the UK. You can kind of have that kind of booking link, and others where you won't. And I think, as Ed mentioned, I think it'd be really interesting to test that. But I don't think it necessarily has to be so complicated or so different. I think it's about finding what those differences are, what those similarities are, and definitely scaling it up, and just kind of adding on to, the kind of, there's a real rationale for, in terms of cost effectiveness, that our campaigns would be far more cost effective if we could reach more people, because we've kind of included the initial cost of creating those campaigns, and then you've got, per reach per book. But if you it's very, very cheap to reach more people. So if you're reaching millions more people, it's going to become even more cost effective. So, if you try that in the US, it'd be quite interesting to see the figures, for instance. So I think there's a real scope there. And then just in terms of other elements, as mentioned, I think a younger messenger approach, I think, I still really want to explore that. But also, as everyone was saying, different messengers for different groups. For ethnic minorities, I do think actually maybe a community leader or a religious leader, depending on a certain group, could be really interesting to look at. Not everybody uses social media among the older populations of those communities. Who is it that would actually generate, who should we be targeting online to make that better impact? So yeah, lots more to kind of build on.
Some really interesting reflections there. Amber, did you want to come in?
Yeah, I just wanted to say, I think from my point of view, we saw some incredible results from the campaign, and I would be interested to see what would happen if we were able to use almost badges on our creative from the government or from the NHS as well, which is something we weren't able to do. And I wonder what percentage of the UK public actually, had heard of the ILC, and therefore, we were able to build some trust and credibility, but how much more would we be able to get if we had government or NHS backing on the creative? So yeah, that would be a really, really key thing for me to explore. The other thing is just thinking about the content that we created and how personalized messages really made a big impact. I think it might be interesting to explore, and I'm not sure if this has been done, but user-generated content and how we use that in social media as well. Obviously a little bit of a dangerous territory because you don't know what people might say, but certainly an interesting one to explore. And how could you do that on a local level, as and when people are coming out of pharmacies getting jabs potentially, or local trusted authority figures that are helping to roll out vaccination programs. Yeah, so they're my 2 points on that. Thanks.
Thank you very much. Some really interesting reflections across the board there. Thank you. My next question is about one of the biggest challenges we faced in this research, really, which was that the social media platforms did not allow us to directly target ethnic minorities. And so we used levels of deprivation in terms of postcodes as a sort of proxy. But I guess my question is, how do you think we could overcome that? I mean, we've talked a lot about measuring the success of social media campaigns, and we also know that the most underserved and those who don't take up vaccinations also can be those from ethnic minorities. So how do you think we get around that? And what role do you think social media platforms play or should play in the sort of element of building trust and the sort of sharing of data? So that's a really big question, but if anyone has any initial thoughts, please jump in. Sophia, I wonder if you have any sort of initial reflections, being that it was one of our biggest challenges.
Yeah, no, I guess because this is a really difficult question. I think that was, we had a recommendation there that, it's definitely worth exploring. Can that data that does, social media companies do own, is there a way that we can tap into that, health policymakers, health researchers, but in a way that we kind of mitigate against those really negative consequences that have occurred in the past? And there's really good reasons why, just a general person for the public can't access that data. So I think it's kind of, for me, it's worth exploring, essentially. I think there's a lot of public good, the potential for public good there, but there are huge risks. So it's kind of a question, can there be greater collaborations because of course we have to mitigate against those really negative consequences. That data can be abused, and it has done so.
Are there any, Amber, did you want to know?
I was just going to jump in and say, I mean, in terms of the targeting, 4 years ago even, we would have been able to target even more granularly than we can now on Facebook and Instagram, for example. Now we can do things like target certain churches or faith groups or communities, but the danger with doing more granular targeting than we did is really comes back to Facebook putting blocks on the account. And I can't it is a big issue. It's happening to lots and lots of social media buys around the world. And you've got to be careful. Saying things like the word vaccine in ads can mean that your campaign will get blocked. So there's a balance there between really digging into, the exact target audience, but also making sure that you're not ruffling any feathers and you don't get switched off by Facebook's AI.
Maybe just to add, if you don't mind, Kate, just a quick comment. I do think it goes back to also blending the online and personal experiences, because if you know that you're targeting, just as an example, a Latinx women community in the Chicago, Illinois of the United States, you certainly know geographically where they are, what zip code they're in, et cetera. But partnering with folks who are in that community, where are you going online? How are you interacting online? So that they're becoming part of the sort of development of the campaign, the content, the messengers, really will help to get you a lot further down the road. Not easy and not cheap by any means, but certainly an important piece, I think, to be able to sort of leverage that gap. I think the big sort of online, tech companies or the platform companies are in a bit of a rock and a hard place, right? I mean, they're trying to balance different people on different sides of that equation. And so I don't know we can expect them to do more. In fact, it may get more tighter as we go forward. So I think it's important to blend the online and the local efforts together.
Great, thank you. That's really helpful. My next question is perhaps it goes beyond vaccination, but I think it is really interesting. To what extent do you think that these findings and this approach, the intergenerational approach and using social media, how do you think that could improve health outcomes for non-communicable diseases? Don't know if anyone has any thoughts on that. Potentially beyond our scope a little bit. Sophia, do you have any thoughts on that?
I was going to say I've got a couple of things perhaps I could say about it.
Yes, please, Daphne.
We're back to the idea of asking people what they want to, or back to what platforms they want to hear it in. I mean, in the stuff that we've just done with ILC, with regard to increasing vaccine uptake in people with chronic diseases. I think it's that there is lack of information, certainly in those groups, but it's asking those groups and the people who are perceived as good messengers in those groups, how they can get their messages across. And what platforms they use. And I think this has already been said, actually, that it's the messenger and the way of putting the message across. And yes, I certainly think that every possible platform can be used in all groups. But it's how you come to it. With particular faith groups, for example, I'm sure that there are particular parts of the communities that are interested in or will engage with particular faith communities. So once again, you've got both the messenger and the platform to put these messages across, and it has to be a blended approach. But certainly, I think that your audience, whether it be those with chronic diseases or almost any audience, you tailor your message and your messenger to that group. to that audience. And I think that's the important thing.
Thank you. Sophia?
Yeah, just kind of picking up from that, I definitely do think there is scope. I mean, yeah, I think what kind of led us to actually, we did see that, I think I mentioned that paper in China that encourage younger adults, younger students at school to encourage their fathers to quit smoking. So it's definitely that intergenerational approach works in other areas. And it'd be quite interesting to see how they work on social media. So for instance, in this campaign, we know some younger people felt a bit hesitant about vaccine misinformation. Are they sharing the right stuff? They didn't know about some of the vaccines. So maybe something they know about, like smoking or another health behavior, could be quite interesting to see, is it more effective or less effective? But I do know, that many people hadn't heard of the pneumococcal vaccines. That really encouraged people to maybe share that. So it would just be really interesting, I think, and definitely scope to try that. And as mentioned, can younger generations be involved? Older generations could maybe both at the same time. I think there's just scope to explore this further. It's cheaper to reach younger generations. So, why not consider that for other kind of conditions? And I think there'll be different barriers and different findings, but, it's definitely scope to explore.
Thank you. I wanted to finish with one final question for everybody on the panel, which is, what do you think the future will hold for vaccine confidence? Are you hopeful for the future, and how do you think things will change going forward? And anyone can jump in. Sophia, I'm going to pick on you first.
Yeah, so interesting question. Forecasting the future. I guess I think it's kind of the point earlier that actually those that have really strong anti-vax sentiments are actually a really small group, and there's this huge group of undecided people on vaccination, and that's, I think, a lack of information access, the stuff that's quite easy to kind of overcome. So I hope that we see more investment to kind of overcome that kind of hesitancy. I think it's quite easy to do. I think it is probably likely to be cost effective, and there's just huge potential there. In terms of those that have really kind of hardcore anti-vax sentiments, it's a lot trickier. They're a lot smaller group. I think it's still really worth looking at. But at the moment, I'm not sure we're seeing kind of positive trends in that area. I think it's about splitting the two up, and doing what we can really. And I think for the former, really understanding their concerns, having people that really can speak to them, maybe somebody who changed from an anti-vax, someone who would never have had the vaccine, someone, that personal kind of approach would maybe be worth trying. But I definitely think that other group, there's a real scope, and we know it works.
I'll jump in just to say that I think we have a real moment currently to recognize the global narrative that everyone has been involved with over the last 2 years, and a real opportunity to sort of capture the imagination, to capture the confidence of global communities everywhere in recognizing the value of vaccines. I think arguably we're in a better position now than probably the last 30 years, because I think there's never, for most people that are alive, there has not been such a compelling way to understand the value of vaccines. So I think the onus is on all of us, many of us speaking and listening today, to take this moment, to sort of capture this moment, to be able to understand in the way that the ILC report has emphasized, and a lot of other work that's going on in this space, to say, how do we capture that narrative, and how do we create sort of the appropriate nuance? We push it out on the right platforms. We use the right messengers to continue to emphasize that. And so if I had to say, is the future bright? We know there are huge challenges, and people are dealing with a range of challenges right now very acutely, well outside of the immunization space. But I think we have that opportunity now to really reinforce how powerful vaccines have been. They have been the exit strategy from the pandemic. And if we can continue to connect that to the powerful ways that vaccines save lives in so many other ways, I think we have at least a good place to start and great potential.
And I'll just build on Stacey's comments if I can, Kate, for just a quick moment. I think we all know vaccine confidence was here long before COVID-19. It'll be here long after COVID-19 becomes more endemic. And I know that it just really, I think, gave us a chance, and maybe it hit the reset button for us to know that we have a huge gap. And to Stacey's comments about educating people on the value of vaccines. And many people just, whether I think you're part of the industry, whether you're part of the healthcare profession, or whether you're just a lay public, I think we took for granted. People should be able to recite the fact that next to clean drinking water, vaccination is the most successful public health program we have. That should be common knowledge, and shame on us if it's not. And so I think we have work to do. I think this clearly gave us, sort of a coordinated, unified effort for all of us. It has to be both public and private. It has to be joint, and I think it has to be consistent. And I don't think we can allow this to be politicized or religiousized and to become part of people's agendas. That's just not fair to the future generations. We have to make sure that our younger healthcare practitioners, our younger kids know the benefits of vaccines. And I think we all own a piece of that stake. But I am very hopeful that I think it's given us a good wake-up call to do that.
I agree completely. I think there's something about really recognizing there's lots of pieces to the jigsaw here, and this is a valuable piece. And if we can replicate this across different countries and settings and professions, then that's about spreading this piece. But I think also we shouldn't underestimate the power of this being transferred over into non-communicable diseases and into the prevention strategies more widely. So I think this is a proof of concept for a lot of other initiatives. I couldn't agree more, Michael. I think there's something about us joining forces now. Apologies, forces, military. Yeah, I didn't mean that. Joining efforts, joining our approaches, and using tools like this, using pieces of the jigsaw like this to the best advantage. Social media is here to stay. It's a very good communication route when used properly. It's a very good communication route when used improperly as well. We know it reaches the parts of society that other routes don't. And I think there's something here that's really tangible about not just this vaccine, not just all vaccines, not just the situation we're in at the moment, but also more widely in other agendas as well. And there's a lot of learning here. It's really useful. It can't do everything, but it can definitely do something. Thank you.
Yeah, if I could come in on this question of what the future holds for confidence. And the recent past isn't always a good guide to the future, but if I were to apply one word to vaccine sentiment over the last couple of years, I think it would be the word volatile, because what we saw was big gains in confidence after the positive announcements around COVID vaccines and their safety and their efficacy at the end of 2020. We then saw plummeting confidence in some countries just a few months later due to safety concerns around some of those vaccines. So we really have seen an awful lot of volatility. But I think to spin a positive message out of that, what that tells you is that opinion is very much kind of up for grabs, and that it is up to the public health community to kind of shape the narrative, as has already been said. But the cautionary note, obviously, is that also means that it's no time for complacency, and that we could see future variants emerge, or any number of possible factors that could send sentiment down again. So I think the future is very much meant to be. Future is very much there to be written, but there is a huge opportunity to lock in some of the heightened public awareness that has come about over the last couple of years, as has been said already.
Thank you, everyone. Andrew says that his microphone isn't working, but he did say that he'd like me to say, as a response to this question, that he hopes that part of the legacy of the pandemic will be engagement and interest in science across the generations, and an understanding will grow that vaccines are not just luxury, but that our very lives depend on it. So I think that's a very helpful closing remark. Any final remarks before I close the session? Great. Well, thank you very much, everybody. I think it's been a really interesting discussion. I think not only have we talked through our findings, but we've highlighted key questions for the future, areas of opportunity, and already talking about collaboration. So I think that's fantastic discussion. Thank you very much, everybody. And thank you everyone for your questions. Very interesting discussion. I think my sort of biggest take home point here is that, despite the fact that we couldn't necessarily measure the impact of engaging young people in terms of turning that information into action, I think this did prove that there is huge potential in using young people as advocates for public health. But I do think that the research showed that this campaign unequivocally, I think, says that this should be a tool, social media should be a tool for every health campaign, and that there is a huge potential in those sort of intergenerational relationships. But a lot more work is needed. We need to measure better, we need to understand better, and we need to target at a local level. We need to understand how we can involve communities. Even the negative comments that we attracted actually created a dialogue and enhanced reach, which I think was really important. So thank you very much, everybody, for joining us today. I hope our conversations continue, yes, very excited to sort of finish this programme. It's been a wonderful experience and extremely interesting. So thank you very much, everybody.